Hello, my name's Jonathan Pollock. I'm consultant neurosurgeon at BMI London Independent. Well, my practice at BMI London Independent and the team I work with is largely concerned with treating brain tumours. And as you can imagine, it's a huge thing to happen to somebody to discover they've got a brain tumour. And it's very much a privilege of ours to help diagnose what the problem is, take them through the treatment pathway for that, both to advise them what they're suffering from and then treat it for them. And one of the great things about the brain that makes this such an interesting area is the huge range of ways in which these tumours can turn up. The brain's remarkably good at putting up with a growth in it without necessarily causing much in the way of symptoms. So patients come to me as a neurosurgeon from a whole range of different colleagues, partly from neurologists with neurological symptoms, but very often, especially given my interest in tumours at the base of the skull where there's a whole bunch of nerves involved, with some specific function that's been affected by the tumour. That might be, for example, loss of hearing, it might be impairment of vision, sometimes even loss of speech or something similar. And that helps guide where we go in terms of investigating the problem. So for many of these patients, it's typical for them to be investigated. We're happy to live in an era when we can very often get very close to a diagnosis, if not make it precisely with imaging. And we're well supplied here with very good quality MRI. And that very often helps, if not make the diagnosis precisely, take us pretty close to it. And then between us, we can advise the patient where to go next in terms of further investigation and treatment. One of the other advantages we've got at BMI London Independent is a team of colleagues with all the skills we need to help do that. And we have a regular meeting together to discuss both what we've found and how we will guide the patient through diagnosis and treatment. And that involves the help from the neuroradiologist, who will often make the diagnosis for us. And then as a neurosurgeon, one's job is to guide them about the different advantages and benefits of either a biopsy to confirm the diagnosis if we think surgery isn't going to be the main way of treating the problem, or of course take them through that technical pathway of actually treating the tumour, removing it and getting them cured. So we've got a range of possible options when we find a tumour. It's remarkable how sensitive MRI is at finding abnormalities in the head. So quite a lot of patients, we find tumours that we know we can advise them that there are good alternatives to surgery. And sometimes that's as simple as keeping a tumour under careful observation. Because MRI is so sensitive, a large number of patients have abnormalities in the head that are discovered which we can safely keep a watch on without needing to recommend direct treatment. But when we do come to surgery, that's a process of finding the safest way to get into the head and the safest way to remove the tumour. And over the last 10 to 15 years at London Independent, we've gradually added to our armamentarium of how we safely do that. And that's partly by adding to the team that we work with. So for example, we've got a high dependency unit here which is staffed by neurointensivists who work closely with us as surgeons, and also by adding to the equipment that we have that allows us to do surgery with maximum safety. And there are various changes in how that's happened in the time that I've been a consultant. The most obvious is in guiding us to where we are in the head, so that image guidance systems have gradually got better and better, which has allowed us to make smaller and smaller access to do what we need to do to safely remove a tumour. And we're happy to have just taken delivery of a brand new image guidance system here, which is a great help to us in that regard. And we've also got a very skilled and familiar team of anaesthetists and a theatre team who've gradually over the last 10 or 15 years added more and more to their skill set, which helps us to guide the patient through the pathway as safely as possible. Once we've carried out surgery, the MDT, as we call it, the multidisciplinary team, comes into its own so that we can share the result that the pathologist has discovered, and that helps us know whether surgery on its own is the correct way of treating a tumour or whether we need to add to that. And that's where our oncology colleagues come in to recommend whether extra treatment in the way of chemotherapy or radiotherapy is necessary. That's more often applicable with malignant tumours, but also occasionally with benign tumours as well. So there's a sort of pathway through the initial diagnosis with radiology, through to surgery, and then to completely treating the tumour, partly with the operation, but very often with the aid of the advice that we get from the oncology team as well.